Hello, Camarena staff and friends. I hope that you're all doing well and staying safe during this time. We here at Camarena have continued to diligently do our part to continue to provide services as safe and responsible as we can for both patients and staff. Since our last communication, new steps have been taken to enhance our COVID-19 response efforts. Some of these include the following measures. We have increased our testing capability so that we are now testing full days Monday through Friday. This has created additional access for individuals to be tested for COVID-19. As we know, testing is how we get a sense for what amount of coronavirus is present in our area. It also helps patients who are positive to know what to do about work and their families. And finally, it helps to control spread of the virus since we are able to provide isolation and quarantine advice. We continue to have staff at the entrance to our facilities that help to screen patients before entry and to provide masks if needed. Patients receive specifically colored wristbands to show that they've passed the outdoor screening area. We've also expanded upon our patient screening measures by adding a secondary screening step. This secondary screening allows for us to further understand the possible risk a patient has for having coronavirus infection and helps us to direct the patient to the appropriate destination for care. We have expanded upon our employee health screenings. Employees are screened every day upon their arrival to work with both a temperature check and having to answer 5 simple health questions. Any employee who is cleared is given a colored sticker to place on their badge for that day. An employee who does not pass the screening is sent home and evaluated further with a phone call. Patients with acute sick symptoms are directed to specific locations, while patients who are healthy are scheduled at sites along with other non-acutely sick individuals. This has helped to avoid the interaction of healthy and sick, thus reducing the risk of spreading illness. We've restricted patient visits to include the patient only. If medically necessary, only one visitor may accompany the patient to their appointment. We've also made it easier for patients to get access to care by implementing telephone visits. Our behavioral health department has had great success in providing phone consultations with their patients, and our medical providers are doing a blend of in-person and phone visits as well. Doing phone visits helps patients to stay at home, but still be able to connect with their primary care home for medication refills, lab orders, and consultations. Patients aged 65 years and older are encouraged to use phone visits. If an in-person visit is needed, we direct them to a location that is providing well-type care. This reduces their risk of coming into contact with someone who is ill. There are dedicated staff to monitor our personal protective equipment levels on a daily basis. We have established reports to understand our usage and days on hand as well, so that we can anticipate where additional supplies will be needed. Our COVID task force meets on a regular basis. We discuss our current strategies and evaluate if any changes are needed. Lastly, Camarena leadership continues to meet regularly via scheduled phone meetings with local health entities. These include the Madera County Public Health Department and local law enforcement. These meetings provide updates on the current COVID-19 situation in our area. These are amongst many changes we have put into place since the pandemic began. Camarena may look and feel a little different. What has not changed is the determination to serve our patients and our community wherever and however we can. We hope that you stay safe, stay at home unless it is essential that you leave, practice social distancing, wash your hands with soap and water frequently, avoid touching your face, and avoid any gatherings. It is also important that you be sure to take care of yourself. Whether that's finding a good book to read, doing some exercise in your home, having family game nights, or even some simple yoga or meditation. Self-care is important, and so is taking care of others. So make a call to friends and family, or video call them if you prefer. Check in with them, say hello, and see how they're doing. Taking care of yourself and others is how we're going to weather this pandemic. So let's make sure we're all helping each other. I thank you for the courtesy of your attention. Until next time, be safe.